Computer recording, it says. Okay. So here we are with Pat Merryweather, past district governor for District 6450. She's in healthcare, and she's going to give us an update for the week ahead on this COVID-19 virus.
Thank you, Hunter, and good day, everyone. And I know that everyone has been watching the television, listening to the news. And the weeks ahead in Illinois are going to be critical. And there's some key components that I want you to be aware of, because I think as Rotarians, you can be extremely helpful in helping communities address these issues. The first one I'll be talking about is nursing homes and the COVID-19 infections in nursing homes and how you may assist. Not in getting the virus to them, but in terms of helping to stop the spread of the virus. The second item that I'll be talking about is focused on advanced directives. I know it's not a fun topic. It always comes that the major day is the day after tax day. So again, they bundle those two issues together, tax day and advanced directives. And then the third item I'll talk about is really helping families during this crisis, because this pandemic is affecting so many people in so many ways. So getting back to the first item, nursing homes. Nursing homes have been a large source of the infections that are occurring with COVID-19. And because they're in congregate housing, meaning they're close quarters, that if one person gets the virus, it typically spreads to others because they're living together, they're eating together, they're talking together, they're congregating as a community. And so what has happened is there's been some major outbreaks. Certainly the first one was in Kirkland, Washington. And I think we all know about the nursing home there and how it spread throughout the community. And then there was the one in Willowbrook, Illinois, with 51 residents and staff infected, and with 7 deaths so far, and with people still in the hospital. And then we've had New Jersey with a major outbreak, and most recently in San Antonio, Texas, where there's been almost 100 people that have been infected in a nursing home. Now, what this means is why it's so important to be aware of the nursing home issue is because they're the frail, they're the ones that are at high risk. If you talk about COVID-19, in the highest risk categories. And so the Centers for Disease Control and the Centers for Medicare and Medicaid Services have instituted very strict guidelines in terms of infection control and prevention. So if you can't get into a nursing home for a visit, and that's because they don't want anyone in a nursing home that could be asymptomatic or be a carrier of the virus. And they also have it for anyone, whether it's vendors, whether it's staff. Staff have to be screened every time they show up for their shift. And the screening involves temperature checks, but also respiratory and a series of questions that are asked. Being around a COVID-19 person, the staff have to go for testing. And so as a result, we have staff that can no longer perform their work in a nursing home until they're deemed, COVID-free, or they've been quarantined for the 14 days. So the issues in nursing homes are very critical right now. And one of the things that we've heard so much about is personal protective equipment. It's the goggles, it's the face mask, it's the gown, the gloves. And if any organization has a shortfall, it is nursing homes. And so if you can, contact your nursing home that's in your community and ask them if they need assistance with PPE. Now with the PPE, the state will get the nursing homes the PPE because they're very concerned. There's over 800 nursing homes in Illinois. So it's a lot for the state to cover, a lot for them to keep in contact. And you being in the community can be a major source of helping out the nursing homes. So I know oftentimes people are aware of their hospitals, but those nursing homes need your help as much as possible during this time. The second area I want to talk about is somewhat connected to the first, and that's advanced directives. But this is really for everyone. We oftentimes think of COVID-19 patients are just the ones that are over 65 and with comorbidities or advanced diagnoses of conditions, but they also are young people, people that are under the age of 65. And one of the things nobody seems to think about is advanced directives. Do you have a living will? Do you have a power of attorney? Because you're going into, if you're being admitted in an emergency situation to the hospital, you're being admitted, and if you don't have those directives in place, they have to make the decisions for you. And it may not be what you want. It may not be, again, it gets complicated, very complicated, and they have to act fast. So the best complete your power of attorney. And for those that are in nursing homes, there's an additional form called the post. And that is a physician order. It's a conversation between a physician and a patient and their family, a resident and their family. And it's focused on what are your wishes at end of life. And I have to tell you that these are critical issues because hospital staff are struggling with this. They don't know what people's wishes are. And so, unfortunately, they have to make those decisions. And again, easy to do. Like I said, April 15th is typically tax day, no longer tax day this year, but the National Decision Day for Advanced Directives is April 16th, and it has been that way for about 12 years. So please really think about that. If you have a loved one in a nursing home or in any other level of care, if they were to be sent to a hospital, you need to make sure that they have the most current information available. So don't wait until it's an emergency situation. Really take care of it now. See that they have the most current advanced directives. And again, you'll feel a little bit more comfortable. Now, the third area ties into all of this too. And this is where we need to help them in the hospital cannot see that loved one. They cannot visit. Similar to nursing homes, there are no visitors allowed. The only visitors allowed in the hospital are a partner to accompany the mother delivering a baby. That's it. It's very strict. And it has to be because, again, they're trying to control the environment so this spread of COVID-19 does not occur. Health emergencies don't time themselves around COVID-19. They're occurring constantly throughout the day. So with this, we hope that you'll talk to the community providers, the hospitals, the nursing homes, see what needs they may have for supporting the families. If you know families that are going through this, the worst thing I can ever imagine is having a loved one, seriously ill or at end of life and not having family there around them to help them with their passage. So think about how you can assist the family. We urge people to make sure that they're planning ahead, just like your advanced directives. If you're going to be heading to the hospital, not willingly, I'm sure, but heading to the hospital, please make sure that you also have some way of communicating with your family. And whether that's through your iPhone with a charger, as well as an iPad with a charger. I know that some Rotarians are getting together and they are purchasing iPads for nursing homes and hospitals that need them so their families can communicate with their loved ones. And that is really because if you've seen anything on, the television channels with people at end of life losing a loved one, the most important thing was to hear their voice. So again, think of as Rotarians how we can help our communities, help our people in our communities, uh, because the need is great. We all have needs, but this is when Rotarian communities. Thank you. Thank you, Hunter.
Well, thank you for doing this. I will get it fixed up and edited, and we'll get it up on the district website.
Okay, great.